Tim O'Keefe. I'm the CEO of Symmons Industries. First off, I would like to thank Governor Baker and Lieutenant Governor Polito for visiting our facilities today and for their leadership in helping guide the Commonwealth through this crisis. Since the beginning of this crisis, the help and guidance we've received from the Governor, Lieutenant Governor, their staff, and the other state officials, as well as local officials here today, Braintree Mayor Chuck Koukouris, have helped us remain a viable company that is poised to continue to grow and to work our way out of this crisis. I'd also like to thank the members of the press who are here today in attendance. Your work to help amplify the guidance from the Governor and health entities and to help educate how we all can stay safe has been very helpful to the folks in the Commonwealth as well as to the team here at Symmons Industries. Symmons Industries was founded in 1939 by my grandfather, Paul Symmons, when he invented the pressure balancing valve. Since then, we've proudly manufactured plumbing and water management products. We currently produce over 3,000 unique SKUs at our factory just across the street. Over half the homes in Massachusetts have a product from Symmons in their bathroom, and our temporal shower valve has set the standard for durability and reliability since its launch in 1968 and its relaunch last March. During the past 80 years, many world events have presented challenges to our business, but never before have we been faced with a challenge as great as the COVID crisis. The unique combination of trying to keep a business stable while at the same time keeping your team safe and healthy is unprecedented. But as we always do, we tapped into our commitment to quality, our teamwork, and our customers to find ways to create solutions. Our custom design team utilized 3D printers to create ear savers, which were donated with PPE to help frontline workers at the South Shore Hospital. We tapped into our expertise in making copper, brass, and bronze products to create the Symmons Safe Key, an antimicrobial touchless door opener, which is helping us to raise money for Feeding America, the country's largest hunger relief organization. And finally, our IoT-enabled Evolution platform. The Evolution platform has allowed hotels to monitor and manage their water during this time of crisis and limited staffing, and will eventually allow them to reopen safely. I have never been prouder of the team for coming together over the past 60 days to support each other and our customers. I would again like to thank Governor Baker and Lieutenant Governor Polito for their guidance during this crisis. There is certainly no playbook for managing a business through a pandemic, so their guidance that they have provided and continue to provide has helped our team stay safe, and that has been invaluable. Thanks to this help, our business has been able to weather the crisis, and we are now focused on growing our business and continuing to service our customers. On behalf of the men and women at Symmons Industries, thank you, Governor Baker, and thank you, Lieutenant Governor Polito, and welcome to Symmons.
Thanks, Tim, and thanks again for hosting us here today. I can't help but think about the fact that the Lieutenant Governor and I were here just about 2 years ago, and well, suffice it to say that when we spoke to the team here, we weren't abiding by the same rules with respect to social distancing that everybody does now. There was probably, I don't know, 150 people, maybe more, right here in this lobby at that time. And as the Lieutenant Governor and I walked the manufacturing floor, we talked with Tim and with Mike Brown about the issues associated with changing the nature of the way they operate to both meet the industry-specific guidelines that were developed by the Commonwealth, but also the guidance and advice they got from the local Board of Health here in Braintree. And thank you, Mayor Koukouris, for being with us, and thank you, Senator Timilty, as well. And it's interesting, Tim said that one of that people were okay with the idea that there were going to be changes in the way they actually did their work. And given everything everybody knows about the contagion associated with COVID, that seemed pretty consistent with what they would have expected and anticipated. But Tim said the hardest part was the social distancing and separation in the cafeteria, where people now, when we walked through the cafeteria, people were sitting one to a table. The tables were pretty far apart, not a lot of conversation going on between and among the members of the team. And you could see that, you know, one of the major challenges that we will all face going forward on this, not just here at Symmons, but in workplaces across the Commonwealth and probably across the country, is some of that intimacy, that physical intimacy that is so much a part of the shared commitment to work that many people who work together for a long period of time have, will in fact go away. And that is going to be the way it is going to be for some period of time here until we get to the point where we have treatments or a vaccine. And I think in many ways we focus, as we rightly should, on many of the key issues associated with the production line. But once again, the production line issues, those are ones people, generally speaking, probably have the capacity and the ability to adapt to pretty quickly. It's the loss of the socialization issues, and the sense of team and the sense of community that comes with those opportunities to sit together and talk about what's going on with your family or what's going on with your work or what's going on just generally that we're going to all have to deal with. I say all the time that I talk to the Lieutenant Governor more now than I ever have, and I spend less time with her, far less. And I think that's going to be true for a lot of us as we all move forward. The sort of physical closeness associated with work is clearly going to change. And with that, obviously, will come some pretty significant changes along with it. The Lieutenant Governor and I were actually very positive about how many companies here in the Commonwealth said they were going to continue to make it possible for their employees to work from home and work remotely. We, the Commonwealth, happen to be one of those. I certainly believe it's absolutely the right thing to do with respect to with COVID and all the guidance we've gotten from the public health folks and others. But that will create some distance, and it won't just be physical distance, it will be lost. There will be a lost opportunity there for people to engage with one another. And I think in some ways that's part of what the next act associated with all this will be about. I do want to give a quick update, as I do every day, on testing and on hospitalizations. Yesterday, almost 8,000 tests were reported across the Commonwealth. That brings the total number of tests conducted to over 776,000, almost 777,000. Less than 10% of the tests reported yesterday came back positive. That percent of positive tests per day has remained at or below 10% for about a week now. That's a very promising development and a promising trend, one that we obviously hope to continue to see a decrease over time. As of yesterday, there were 2,472 patients who were hospitalized with COVID, which is another decline from the day before. And as we've said repeatedly, it's this public health data that is the primary indicator of how COVID-19 is impacting our communities, and it will determine how, when, and where we reopen our economy. On Monday, we announced a new public-facing dashboard of 6 key indices that we'll use to note our progress, trending positive, in progress, or trending negative. That dashboard will be calculated based on many of the stats that I go through on a typical daily report. But in addition to that, there are a few more that health experts have made clear to us are particularly important with respect to tracking the penetration and the presence of the virus. The dashboard includes COVID-19 positive test rates, the number of individuals who died from COVID-19, the number of hospitalized patients with COVID-19, our healthcare system readiness, which is a measure of ICU beds, surge capacity, and a number of other elements like that, and then testing capacity generally and our contact tracing program. We hope that as time goes on and we slowly and carefully reopen different sectors, that the dashboard will keep trending in the right direction. And it's critically important, and I can't say this enough, that we all remember that everybody has a role to play in slowing that spread of COVID. Please continue to do the 4 things we talk about on a pretty regular basis. Cover your face when you can't distance yourself. The science is clear. Science is clear. Simple face coverings prevent the spread of this disease incredibly effectively. Wash your hands and wash surfaces open. I'm going to try that one again. Wash your hands and wash surfaces often. That one, of course, also needs no explanation. Keep your distance. Again, we know this one by now is critically important. The more we stay 6 feet apart from one another, whenever possible, the more we stop the spread of the virus. And lastly, stay vigilant for symptoms and stay home if you think you're sick. We all know that one by now, too. And as I said several days ago, we've significantly expanded, the Department of Public Health has significantly expanded the criteria through which people can get tested if they believe they're symptomatic. We want people to take full advantage of that. DPH has issued guidance on this, and the Division of Insurance has also issued guidance to health insurers as well. And finally, we'll continue to pursue every avenue that's available to us to make sure we get PPE, personal protective equipment, into the hands of frontline workers and law enforcement officials in every community across the Commonwealth. As of yesterday, we've delivered over 11 million pieces of PPE, including masks, gowns, gloves, and ventilators. As businesses reopen, it will also be important for them to stock up on the certain supplies that they need, such as cleaning spray, disinfecting wipes, and face coverings. And remember, businesses should not buy medical-grade masks. They should be reserved for our healthcare workers. And as part of our reopening plan, we've developed 2 resources for business owners that they can pursue: a guide to educate businesses about what supplies are needed to return to the workplace, and a portal to connect businesses with manufacturers and distributors. We also launched a portal to connect Massachusetts businesses in need of supplies and manufacturers whom are actively producing and selling hygienic and protective materials for them. On Monday, we launched Phase 1 of our 4-phase plan to reopen the state's economy in the wake of the COVID-19 pandemic. The goal of the phased reopening is to methodically allow businesses, services, and activities to resume while avoiding a resurgence of COVID-19 that could overwhelm the healthcare system and erase much of the progress that we've all made so far. The Reopening Advisory Board, in conjunction and in consultation with the Department of Public Health, published new workplace safety standards and sector-specific safety protocols to ensure that as employers, workers, and customers return, they do so in as safe an environment as possible. And today we're pleased to be here at Symmons to tour their manufacturing facility in Braintree. Symmons, as Tim said, is a 3rd-generation company that's been in Massachusetts for more than 80 years. They manufacture high-precision commercial and residential plumbing products, including many used by hospitals and healthcare facilities. They've been operating since March to supply products needed to support healthcare facilities, including small batch equipment like 3D printed mask holders, but like many others, their production and demand significantly slowed down due to the impact of COVID-19. But as Phase 1 begins and they start to ramp back up, this facility has done a terrific job in reimagining their operations from the floor layout to new cleaning protocols. Symmons also had to implement new protocols, as I said before, for social distancing, hygiene, staffing, and operations. Moving forward, they're working to scale their operations back up as customers start to come back and as we all return to some sort of a new normal. All of us, employers, workers, customers, and community leaders, continue to have a role in pushing back against the virus. Symmons stands as a strong example of how this can be done safely and responsibly, and we applaud their efforts to adjust to these difficult times. The Lieutenant Governor will talk more about the necessary steps businesses need to take and how we can support them in that process. But to businesses across the Commonwealth, we just want you to know that we'll work with you and we'll support you in your efforts to create a new kind of workplace. Our shared goal is the safety of the employees and the workers throughout the Commonwealth, and you need to continue to implement the measures and protect your customers that are deemed appropriate by our guidance. For more information on the Reopening Advisory Board and these new resources, you can always visit www.mass.gov/reopening.